Hi, my name is Saad Usmani. I'm an assistant professor of medicine and director of developmental therapeutics at the Myeloma Institute in Little Rock, Arkansas. Within the Arkansas relapse refractory myeloma patient experience, there was a phase 2 clinical trial conducted employing carfilzomib as a last minute salvage or last effort salvage intervention in that heavily pretreated patient population. A total of 121 patients were treated on that protocol. In addition to that, there were 22 patients treated as a single patient IND application to the FDA. What we wanted to look at in this particular patient population, given the clinical impression that we had of a higher incidence of cardiopulmonary events, we conducted a retrospective analysis to look at severe cardiovascular complications defined by the usual cardiovascular events such as heart failure, acute myocardial infarctions, tachyarrhythmias, which prompted a hospitalization of a given patient while receiving carfilzomib as a drug by itself or in combination with other drugs. Now, the caveat here being that these are heavily pretreated myeloma patients. They are more susceptible to infections, and they have also seen in combination therapy varying dosing of other cardiotoxic drugs such as adriamycin. So overall, out of the 143 patients, we found 27 patients who met the criteria of having a severe cardiovascular complication, but majority of those patients had competing risk factors or other comorbidities that were confounding the picture. Overall, there were about 11 patients who clearly had a cardiovascular event that was related to or could be attributed to carfilzomib, but again, in this really heavily pretreated patient population, that amounts to about 10% or so patients, which is consistent with the data that has already been reported in the registration phase 2 trial. We also noticed that patients who had doubling of their BNP before and after treatment with carfilzomib were at high risk of developing cardiovascular events, but again, these are initial findings and further research is needed to really elaborate on the mechanisms of why this is happening.